All right. You may have determined that what your pain is SI joint pain, and you've been searching all over the internet to try to find answers as to whether or not SI joint pain is permanent or what it is that you can do about it. In today's video, we're going to be answering that question. Is SI joint pain permanent? As well as including the different options that are available and explaining what those are so you can decide which one's the best for you. Okay, first off, where is SI joint pain and what is it? So your SI joint is your sacroiliac joint. So this is the sacrum. It's the heart-shaped bone that's found at the bottom of the spine. These are the ilium. Most people call them their hip bones. And the sacroiliac joint is found in between. Sacroiliac joint, in between. You have one on each side. Now, it's a little hard to see on Captain Jack here, but imagine if he had muscles over here, these would be his glutes, because you can see his hip bones right in here. So a lot of people who struggle with SI joint pain have pain that they feel deep in their glutes. Thanks, Captain Jack. So what causes SI joint pain? The two most common causes I see in the clinic are injury and pregnancy. So injury can be a fall or a slip. It can be stepping off of a curb that you think is either higher or lower. It's not necessarily a big injury, and to be fair, there's some people who don't even remember when it happened. They just know it happened a long time ago. Obviously, pregnancy is another one. As that relaxin goes through your body and prepares to give birth to the baby, that causes the ligaments around the SI joint to relax. Now, for many women, they do heal completely normally without any intervention. However, some don't. Or it may be that you had a slip and fall right after giving birth. And that combination of having the relaxin in your body from birth as well as the injury afterwards is what caused this problem. I had a patient once who I saw a long time ago. She had given birth to her fourth child in as many years. She was a military wife, and so she was home alone with the 4 babies when ice hit, and she needed to go outside and put her garbage out. So she stepped outside, unfortunately slipped on the ice, landed perfectly on her left buttocks, and boom, her SI joint slid out. Now, she not only had pain in the back from the SI joint, but that ilium wraps all the way around to the front. So she had pubic symphysis pain as well as that SI joint pain. So if you're like, hey, I do have pain deep in my buttocks, but I also have pain right at my pubic symphysis, it could be that your SI joint is out of alignment and that's what's causing your pain. I will say, if that's you, you need to seek help because this is not something that's going to heal on its own. She required a lot of intervention, manual, hands-on physical therapy to help her get back into alignment. We also used an SI joint belt to keep her there until her muscles got strong enough that she could do it on her own. There are 2 other possible causes of SI joint pain, and that would be an infection or arthritis. Now, infection is the least common one I see in the clinic, obviously because that's usually treated previous to people getting to me. And arthritis is usually something that we don't see until later in life. Now, the SI joint does move. That sacrum and ilium do move a little bit on each other. So, just like any other joint, you can get a little bit of arthritis. This is pretty controversial, I will say. So if you go to your doctor and your doctor says you have SI joint arthritis, but there's nothing you can do about it because the joint doesn't move anyway, that is still, unfortunately, a commonly held misconception in the medical community. So what can happen is that doctors say, oh, well, the joint can't move and you have arthritis in the joint, so there's nothing that can be done. My question to them would be, how did you get arthritis in your joint if it's a joint that doesn't move anyway? The SI joint does not move very much, but it does need to be able to move to get proper nutrition. When it doesn't over a long period of time, you will come up with arthritis. However, just like every other joint, just because you have arthritis in there doesn't necessarily mean it's painful. So I would say if you have been diagnosed with SI joint arthritis, you need to find a specialist to work with to, one, figure out what caused it in the first place, and two, keep it from progressing and getting worse. Now, let's talk about the different types of SI joint pain. There's acute SI joint pain and there's chronic SI joint pain. Acute pain is usually the one that comes from an injury or stepping off of a curb or falling on the ice or something like that. It is a pain that most of the time my patients come in and they can tell me this is what caused it. This thing happened and then I got this pain. As opposed to chronic SI joint pain. Many of my patients come in, they're usually in their 40s or 50s at this point, and they say, I don't know, it just kind of started, I can't remember what happened, it's kind of this deep achy pain. It usually gets worse after I do increased activity, so not with the activity. It actually usually feels better with the activity, but after they do increased activity, they'll notice it like at night when they go to bed. Now, for many of these women, the problem actually started when they were younger, most likely during childbirth or as their body was recovering from childbirth, in that things didn't completely recover and go back in the correct position. So this is actually a really chronic problem in that it started a long time ago. So, when might you have symptoms? And this is true for acute and chronic SI joint pain. Everybody's SI joint pain is a little bit different. So realize that you may have some of these symptoms and you may not have all of them. Now, some people with SI joint pain have problems with sitting because when they sit, their SI joint is not in the correct position, while other people have more problems when they're standing because when they're standing, their SI joint is not in the correct position. This could be due to a functional leg length discrepancy, which does not necessarily mean that you have one leg that is longer than the other. What it means is that your SI joint is out of alignment and you have a functional leg length discrepancy. For some people, their SI joint will really get irritated when they're standing for a prolonged period of time. Particularly, people notice this like when they're cooking dinner or if they have a job where they're required to stand in one position for a long period of time. To be fair, I have a job where I stand for long periods of time working on patients, and my biggest issue in life is an SI joint problem. And so how do I know when I'm not taking care of my SI joint properly? I get pain when I'm at work. So I can definitely relate. Now, some people will say that they only have pain with stair climbing, and this is because they have problems when they're weight bearing on one foot at a time. And stair climbing obviously is a higher level weight bearing, right? Because you're fully putting your body weight on one side at a time. And people who have pain going up and down stairs will also usually have pain when you're running, because again, it's that higher level activity. All your weight is on one leg at a time, plus you've got the force and the impact of running. So often people who have difficulty with stair climbing, if they're runners, will also have problems with running. Now, if you're not a runner, you may be a walker, and you may have noticed that when you try to do a nice long stride while you're walking, that your SI joint pain increases. Now again, it may not increase actually while you're walking, it may increase after you've gone for a walk. So a lot of people will tell me, like, I'm fine when I'm walking around the house, because of course we have that shorter stride length while we're walking around the house. But when I go for a walk, I notice that it's more painful or achy at night afterwards. All right, the next question I get asked is, what are the treatment options for SI joint pain? I will tell you, everybody is selling a treatment option for SI joint pain. It is so popular in today's day and age. And yes, I do treat a lot of people with SI joint pain. I'm going to discuss the different options and who they might be best for, so you know what you should be looking into for you. The first question I usually get asked about is prolotherapy. Now, with prolotherapy, what they do is they actually go in and cause a little bit of damage to the SI joint to try to help heal the ligaments and create stability. This is really good for people who are not able to maintain stability in their SI joint. That patient I told you about earlier who had fallen after giving birth to 4 children in 4 years, she would have been an excellent candidate for prolotherapy. However, it wasn't around at the time. The patients I see that do really well with prolotherapy are patients that tend to be hypermobile anyway. So these are the people who were gymnasts and dancers when they were younger. They have always been super, super bendy. Those people tend to do really, really well with prolotherapy. Now, I talked to a doctor recently about this because what I was finding is that my patients were not really getting the benefits of prolotherapy that they were expecting to get. And I will tell you that his expert opinion, and he does pretty much prolotherapy all the time, his expert opinion was that it often takes more than one application of prolotherapy. In fact, he tells his patients that it may take 5 to 6. So I can't particularly speak to that. What I can say is that was his expert opinion. Be prepared for 5 to 6 sessions of prolotherapy. And what I can say is, in my experience, it doesn't always work after the first time. Now, a lot of people want to know if they should get those braces and which one should they get. So again, for my hypermobile friends, my gymnasts and my dancers, those people who really move around a lot and have difficulty maintaining stability or keeping their SI joint in, a brace can be really helpful for a period of time. Yes, I understand it is a Band-Aid. It doesn't actually fix your problem, and you do still need to address that, but we're going to get there in just a minute. It can be helpful, though, to help maintain the correct position. Now, the thing is, you want to make sure you are working with a specialist who can show you A, how to put it on, and B, how to know if your SI joint is in the right position to put the brace on in the first place. And I know you see these ads and they're like, oh yeah, you can just put it on and it eliminates your pain. And it can eliminate your pain if your SI joint is already in the correct position. But if your SI joint's not in the correct position and you put it on, let me tell you, it's not going to do you any good because it's actually going to cause more compression of that SI joint and actually could increase your pain. I have seen this far too many times in patients that they come in and they have already tried the brace and they tell me, oh, it doesn't work. And I ask them to bring it in and we work on it together and I teach them these things. A, what position their SI joint should be in, and B, how to apply the brace correctly so that they're able to get some relief. I do believe in the braces and I do feel like they're really helpful, but you've got to make sure you get the right one and you know the right application. And another thing that people like to ask me a lot about is steroid injections for their SI joint. And people get a little bit confused because they're not sure exactly where the injection is going to be. A lot of my patients will tell me that the injection was in their low back when actually it was in the SI joint. What I can say is while I was doing my PhD studies, I actually got the opportunity to go in and watch a doctor under fluoroscopy do steroid injections to SI joints. And it was amazing. They had like this machine operation, and they got through 6 patients in a relatively short period of time. And by the time the patients had kind of recovered and were ready to go home, their SI joint pain was eliminated. It was shocking, the results that we saw. And you could literally see it because it was under fluoroscopy. As that steroid went in, that inflammation decreased. So if you feel like you are very unstable because of inflammation specifically, not necessarily ligament laxity, but it's just really inflamed in there, a steroid can be helpful to help you get over the hump. Now, again, it is a Band-Aid and it's not going to keep your problems at bay for too long. But if you're working with a specialist already, it can be the thing that can get you over the hump and make your treatment more effective. Now, no matter if you choose prolotherapy, steroid injection, or brace, you need to be working with a specialist because you need to figure out A, how did this problem start in the first place? So B, you can actually heal your SI joint. All of these techniques that I mentioned previously are all Band-Aids. And I understand when you have SI joint pain, a Band-Aid can be super helpful. However, they're not going to last in the long term. You need to be working with a specialist to get to the root of this problem. All right, so I've given you a lot of options for things that other people can do for you. What can you do for yourself right now for your SI joint pain? The first thing I'm going to recommend that you do is watch how you're sitting and how you're standing and how you're walking. You would be shocked at what a big difference just making sure that you're in the correct position during the day can be. So when you're sitting, you want to be sitting up nice and tall. You want to have equal weight bearing through your feet on the ground and equal weight bearing through your cheeks that you're sitting on. Now, it's really important to make sure that you're not in a slouched position, as well as you're not too far forward. So I find particularly that people have difficulty when they're sitting on the couch for prolonged periods of time, especially if you like to put your feet up on an ottoman or in a recliner chair. You want to make sure that you are well supported through your low back because that helps your SI joint to be in the correct position. You may need to put a towel roll under your low back or pillows if you're a shorter person sitting on a couch and you need some help getting your feet onto the ground, or using a stool underneath your feet to lift the ground up to you. When you're standing, it is really important to make sure that you're keeping equal weight bearing through both feet. It's really critically important, and it's not common in our culture today. In fact, if you want to do a little experiment on your own, next time you're at the grocery store, standing in line, waiting to check out, just watch how people are standing, and you will find there's very few people standing with equal weight through both feet. It is critically important for our entire skeletal system, but it is definitely important if you're having SI joint pain. In fact, you may find that you try to move away from that painful SI joint and try to put your weight on the other side. As much as you can, make sure you're keeping equal weight bearing through your feet to decrease pressure in the long term. And now, what about walking? In general, I like to have people walking with nice long stride lengths. I have nice long legs. When I go for a walk, I take big steps. However, when my SI joint is really irritated, I have to tighten up my steps because I actually want to decrease the motion through my SI joint and decrease the irritation just for a period of time. Now, you don't have to walk like a robot and take like these really little steps, but definitely try to keep more of a moderate stride length as opposed to that really long stride length. Again, making sure that you're using proper ergonomics throughout the day. If you're sitting at a computer for a long period of time, making sure that your body's in the correct position, not putting weight on one side or another. If you tend to use the mouse with one side, making sure that you're not sitting on that side for long periods of time can be really, really helpful. If you do work in an office or at a desk for a prolonged period of time, what I recommend to my patients is that whenever you're in a meeting or you don't need to be typing for a long period of time, go ahead and raise that desk up and stand up. Just get your body in a different position can be really, really helpful to decreasing pressure on your SI joint. All right, so my expert insight, is SI joint pain permanent? Not necessarily. However, as I mentioned earlier, I have SI joint problems that I have to manage and continue to manage throughout my lifetime. Luckily, I've had a lot of help from some very specialist physical therapists who have been able to help teach me more about my body, because particularly the SI joint, it's really hard to work on your own SI joint. But they have helped me figure out a little bit more about my body as well as what I need to do. And now I implement those techniques regularly whenever my SI joint pain starts talking. So it's really important to understand A, the root of your problem, what started this in the first place, B, what tips and techniques work best for you, and C, what modifications do you need to make to your daily activities? Because you want to make sure that you can continue doing what you want to do for the long haul. Now, if you're struggling with SI joint pain, I highly recommend you do this pelvic floor exercise instead of Kegels. I'm going to link the video here. It's the exercise that I ask all women to do, especially if you have pelvic floor dysfunction, SI joint dysfunction, low back pain, or any issues with urinary incontinence. Go check out that video next, and I'll see you later.